I want to talk a little bit about anaplastic large cell lymphoma. There's a lymphoma that's associated with textured implants. It's exceedingly rare, and out of millions of women who have textured implants, there's maybe a handful of cases of it. So it is exceedingly rare, something that we're not recommending to all people who have textured implants to take their implants out, but the signs of a problem are if you have a textured implant, and this is an example of textured. I don't know if it translates easily, but this shell of this implant is smooth and this one is kind of rough. So that's a textured implant. And if you have one and you have a sudden change in your breast size, you feel like there's a fluid collection around it, then that's something that you need to see your plastic surgeon to be evaluated. So I'll tell you a little story about a patient that I had that came in with textured implants. Now, she didn't have a problem at all, but just the fact that she had that implant in and the knowledge that this was something that could potentially happen was bothersome to her. And I thought it was reasonable that we take the implants out. And at the same time, she was telling me that she didn't like her waistline. She had lost a significant amount of weight. She had had circumferential abdominoplasty in the past and really wanted these implants out, and she wanted the skin and fat under her arm taken away. So I talked to her and I told her about a bra line back lift, which is a really nice procedure to take those back rolls out, and at the same time it narrows the waist. And I told her we will take that skin and fat that I get from the back and we'll use it to re-augment the breast, because once we take an implant out, something this size, there's going to be a deflation in the breast, and sometimes if you don't put something back in there, the deflated look is not a very good thing for the patient. So we did that bra line back lift, and we were really fortunate that we had great blood supply to that fat, and when we took the skin off that flap of fat from her back, we were able to fold it in and use it as an auto augmentation to her breast, and she had a really terrific result. I think the bra line back lift is a really powerful tool in body contouring. It really helps narrow the waist, and a lot of times women get bothered by the rolls of fat on their back. And the scar from this procedure is very well hidden in the bra line, and thus the name of the procedure. And it does a beautiful job getting rid of back rolls and narrowing the waist. And now I have it as a great tool for people who have removed implants or done things like that, that I could use that tissue for good, and we could get off of the devices and things for people who are bothered by them.